Now at 4, the number of cases of measles across the country climbs today.
And now doctors are urging adults, especially those traveling, to check their immunity against the disease or get a booster of the vaccination.
Western Mass News reporter Caroline Powers joins us now with more on what doctors are saying. So some of us may have to get another shot.
You might, Dave and Beth. There are now more than 700 cases of measles reported so far this year in 22 states, one here in Massachusetts. Health officials say majority of those cases are in children and teenagers, but there is a new warning out tonight with the disease for adults.
Measles cases in the United States have surpassed the highest number on record since the disease was eliminated in 2000. Dr. Booker T. Bush with Bay State Medical Center says this year's growing measles outbreak has doctors concerned.
What I want people to think about is that we thought this disease was gone. And because we've let our public health reflexes drop some, we're now dealing with a disease that I thought I wasn't going to have to deal with anymore as a doctor, except on a preventative basis. And now we need to think about it again.
Measles is a highly contagious disease caused by a virus that can spread through the air when an infected person coughs or sneezes, or if they have direct contact or share germs with another person. Symptoms may include fever, cough, runny nose, and a rash of red spots. But Dr. Bush says the disease can also lead to much more serious problems.
It's not just a rash, and it's not just a cold. It can actually cause encephalitis, meningitis. Actually, if as an adult with measles, you actually have a higher risk of death than when kids get the measles. So it's a very serious infection.
And as the number of reported cases continues to climb, Dr. Bush is sharing an important message with adults who may think they're safe from getting the disease.
Certainly before 1957, most adults, and I'm one of those adults, were more likely to have gotten measles because it was around and there. The vaccines started up after that, but some of the vaccines weren't effective enough. So if people were vaccinated after 1957, we sometimes test to see were they actually vaccinated or was the vaccination effective or not. This has raised the concern of what happens when people don't get the vaccine or have had inadequate vaccination.
And Dr. Bush is reminding people who may be on the fence for the effectiveness of their last measles vaccine, or if you're traveling to an area where there is a current outbreak, to just get the shot again. For Western Mass News, I'm Caroline Powers.